Oh, hi. Didn't see you there. I'm Barbara Walters, and welcome to Several Minutes. Today we'll be discussing healthcare reform in America. Should the government have total control over healthcare? Does it infringe certain American rights? These questions will be answered and more when I interview Barack Obama for the second time this year, as he's back on our show today. But first, we hit the streets to see what people have to say about this new reform. Excuse me, sir. Can I ask you a question about healthcare in our glorious nation of America? My bad, you must be a foreigner. Can I get you someone to translate? Are you a translator, sir? Excuse me, sir. Sir, can I borrow some of your time? Barbara Walters here, from Several Minutes. You may have heard of me. What are your thoughts on the government completely taking control over the healthcare system?
I think the government needs to stay away from our healthcare. It'll lead to socialism and then communism. That's a slippery slope for sure.
Interesting. Do you own some form of healthcare?
Of course not. Healthcare these days is too dang expensive.
That's a good opinion of yours. We greatly value it.
Good. Now get off my property.
Let's go. Let's run. Now, excuse me, young man, but do you mind sharing the youth's perspective on healthcare reform?
Yeah, sure thing, bro. I believe that it's exceedingly beneficial plan to have the government take aggregate control in the healthcare reform process. The private sector was futile in its attempts to reform, and it's obdurate to change its ways. It's egregious that they would be so fiscally motivated despite the inadequate quality of the healthcare in America. Not to mention
Okay, I'm just gonna stop you there, kid. Now, the important thing is that you tried. Excuse him, children can be so naive. Television, it's just brainwashed them. Too much MTV and MSNBC. I'm here now with President Barack Obama to talk about his newest reform, the Affordable Care Act. Some say it's the most the government's been involved with healthcare in recent times. Now, Mr. President, could you explain in your own terms what this new act is?
First off, thanks for having me back on the show, Barb.
It's good to have you back, Mr. President.
Well, my intentions with the Affordable Care Act were to make it cheaper, more accessible, and increase the quality. The first trouble was getting it passed. Lucky for me, the Supreme Court ruled it as a tax, therefore allowing it to be implemented. But many people still saw flaws in it.
Now, Mr. President, I must ask you one last question. How are you going to pay for this?
Well, not out of our pockets, that's for sure. That's why I've introduced several unique ways to pay for this, such as a 10% tax increase on tanning booths, which is why I might be a little whiter than I normally am.
And here, I thought I was the only one that noticed you weren't. Tanner? Anyways, do you think America should follow other countries in its plan with healthcare reform?
Absolutely. Canada has such a successful healthcare system, I came up with this while eating pancakes.
So how do you think this act is going so far?
Well, it's still in the transition phase, but currently 30 million people can now afford to get health care. So, I'd have to say, not bad.
Tune in next week to Several Minutes for our interview with Mitch McConnell.
Here comes the.
Hi, I'm Andy Rooney, and I'm not dead. Have you ever wondered, if Obama was the president of Kenya, he'd be the first white president?